I think this week's series of events for Mental Health Awareness Week has been amazing. We've never done anything like this before. We've had 8 different partners get together to look at employment, education, health, policing, youth. It's great because we need to raise awareness, we need to remove stigmas and make the public more aware of what we do, celebrate the good stuff and actually admit that we're not getting it right in other areas and learn from those mistakes and get better.
It is my honour to host these events at Bournemouth University this week, along with colleagues like James, Poole and Kay. And I think what it really has illustrated is indeed that partnership with, in addition to at the university, Dorset Police and Crime Commissioner, Dorset Healthcare University Foundation Trust, and all the other partners, Dorset Police, Bournemouth Borough Council. Across the week, it's been a phenomenal joint effort to bring these talks together.
Well, that first conversation is absolutely vital. So it's vital for those of us with mental health problems to talk to somebody, whether it's a friend, a family member, a partner, or the GP. You've got to talk to someone about it first. And then from our friends and families' perspectives and our line managers, our colleagues, you don't be afraid to have a conversation. Just show that you care by asking someone how they are. You don't have to have all the answers, but just start the conversation.
The opportunity to work in partnership with Dorset Police and Criminal Justice Services has been an overwhelming privilege. Working in co-location in police custody and court settings has provided services with immediate intervention to presenting vulnerabilities that have led to a greater identification of their needs and thereafter referral onto health and social care agencies.
What's changed in Dorset Police now? We're better equipped at working with partners that are involved in the mental health. We have Bournemouth University come in to assist us with training. We managed to weave training into our first aid training for mental health. We also work with Dorset Mental Health Forum and deliver training to victims of crime who've got mental illness and better equip them so that they can feel safe and make better informed choices as they go forward. There's still quite a bit of work to be done, no doubt about it, but I feel a lot more positive than where we were 18 months ago, and barriers are being broken down.
I think up until now it's been operating in silos, particularly between mental health and police, where too many people end up in police cells, for example, but then also between mental health services and schools. We need to bring these services together. These are all publicly funded. They need to collaborate closely together with everyone focusing on prevention and building resilience. And I think with that sort of partnership, we can make a real difference and make much better use of public money.
So what was very clear very quickly when I got elected as the Police Crime Commissioner was that police were spending 20% of their time dealing with mental health issues. Arguably, most of that time wasn't police-related business, it was other agency business. And in a shrinking environment, when I as Police Crime Commissioner have lost 20% of my funding, I needed to make those outcomes more health-based, not police-based. If you're in crisis, that doesn't make you a criminal. If you're in crisis, you should be in a health-based setting. If you break your arm, you end up inside a hospital A&E. If you break your mind, you should end up in a health-based setting. To put someone inside a police station is outrageous, and I've said that many, many times.
Let's not forget, police, along with the ambulance and the fire service, they're first responders. The things they see, most of us simply would not like to see. And we need to look after their mental health too. So we need to be able to look at ways in which we can train them about not just taking care of their own mental health, but how they can look out for their fellow officers' mental health too.
We are now in a position with our partners and victim support, Dorset Mental Health Forum, to deliver training to victims of crime who've got mental health issues and make them safe, safe. It means at 10 to 2 this morning, when there was an officer in the middle of deepest, darkest Dorset, dealing with somebody who was in mental health crisis and threatening suicide, that officer had one of Stan's team on the end of a phone and was able to give them advice and make sure that the care plan was being enacted and that we dealt with that person in the most appropriate, sensitive manner.
I just want to know a bit more about the street triage. At what point do you involve the ambulance service?
No, we don't have a car. We have a control room that will put that officer in contact with a mental health professional. What we need to do, and we were talking again about, because us four here make this happen, is we do need to make that 24/7. At the moment it's not 24/7, and then therefore you get different outcomes at different times of the day. It is all about value for money against outcomes, and it's about funding.
Well, Martin has shown brilliant leadership, I have to say. I've got great admiration for his work here. And just by way of one example, he just made a very clear statement to all of the providers that no child under the age of 18 should ever end up in a police cell. And it's happened, it's worked. Organisations have responded to that because it was no longer an option.
Well, my bucket list is a multi-agency team that deals with mental health issues in Dorset 24/7. We're nearly there, but we haven't got there yet. And actually that team needs to include mental health advocates, it needs to include mental health academics, not just mental health professionals, and it needs to have people with lived experience as well.